From soap operas to Real Housewives of Beverly Hills, Lisa Rinna has been in the spotlight for many years. Has plastic surgery played a role in her changing appearance? Estimated costs of potential procedures are provided at the end of this video. In 1989, at the age of 26, you can see here that Lisa has a prominent widow's peak, and that's the area right at the center of the hairline. It's a slight projection down that gives the hairline a characteristic look. She has about equal horizontal thirds of her face. Her eyebrows are arched closer to the lateral canthus of the eye. Usually the most arched part of the eyebrows occurs between the lateral limbus of the eye and the lateral canthus of the eye. She has nice supratarsal show, and her nasal tip to me appears more narrow than it was in high school. When we look at photos from her in high school, there is a bit of a tip bulbosity, and when you follow the bridge of the nose from the top down towards the tip, you see that there's a bit of a splay as you get to the tip. In these more recent photos, I don't see that same effect. So I wonder if she had a rhinoplasty sometime between high school and age 26. This would have been to make the tip more narrow, to have a more uniform width to the nose from the bridge down to the tip. Lisa appears to have full tooth show on smile, and she has a strong jaw structure. In 1991, at the age of 28, Lisa's lips do appear to be fuller. She did admit to silicone lip injections sometime in her 20s. This would have likely been with a micro droplet approach, where these small injections of silicone are placed into the lips over several sessions to start to build up their volume. Keep in mind that there's no dissolving agent when it comes to silicone, so it's not like the currently used hyaluronic acid fillers that you can dissolve with hyaluronidase if you're not happy with them. With the silicone injections, you're pretty much stuck with them unless you go and cut them out. And the silicone injections can look good initially, but then what happens is that they create a lot of distortion in the lips later on. And we have more on that later in this video. In 1992, at the age of 29, what I'm seeing here is progressive enlargement of Lisa's upper lip. Now, this was likely due to the several sessions of silicone that she has admitted to having. With each subsequent injection session, the upper lip became fuller and fuller until her desired appearance was reached. It also looks like Lisa may have had a chin implant around this time. Her chin appears to protrude down more, and it's now more narrow compared to her original chin. In 1993, at the age of 30, I see no change. In 1994, at the age of 31, what I wanted to point out here was that her upper to lower lip ratio used to be about a 1:3, whereas now it looks like that ratio is closer to a 1:1. So the upper lip appears to be of a similar size to the lower lip. Now, while that is a ratio that does exist in nature, most people have a bottom lip that's a bit fuller and larger than the upper lip. That's a more classic presentation of lips, and also a more classic understanding of beauty standards, even though those standards are somewhat changing, and they continue to change over the years. In 1995, at the age of 32, I'm wondering if Lisa may have had some implants placed into the jaw closer to the gonial angles. So previously I mentioned there may have been a chin implant placed, but now what I see is there's additional width to the lower face. And the whole architecture of the lower face to me appears to be changed compared to prior. It was a much smoother transition up from the chin to the side of the face, and now there's a bit more of a boxy type of appearance, and it looks like maybe there's been some prominence added to the gonial angles, and the material that would have been placed at that time was most probably still silicone. Silicone chin implants have been used since the 1950s. In 1996, at the age of 33, I see no change. In 1997, at the age of 34, what we're seeing here is a continued change of the upper lip. The shape shape is now appearing to have a lateral prominence. So the portion that's out to the side on both sides seems to be more full and seems to be hanging down more. And you can even see how it covers up some of those upper teeth. And in 1998, at the age of 35, I see no change, and that's the same through 2000. In 2001, at the age of 38, again, looking at the upper lip, there's irregularity at the wet-dry junction. So previously we were seeing just a fullness forming on the lateral aspects of the upper lip, but now we're seeing this irregularity developing. And that's again related to the changes that occur with silicone injections as time passes. In 2002, at the age of 39, this may have been around the time when Lisa started to get Botox injections. Botox became more popular in the early 2000s. So areas like the forehead, the glabella, and the crow's feet are the most commonly injected zones, and it looks to me like Lisa has a fairly frozen forehead, glabella, and crow's feet. With facial expression, you really don't see much movement in those areas. And in 2003, at the age of 40, I see no change, and that's the same through 2005. In 2006, at the age of 43, I wonder if Lisa had cheek implants placed around this time. There is now more medially and laterally based volume in her cheeks, and there's more of a blurred lid cheek junction. Some people place these malar type of implants or submalar implants. As those implants are placed, it reduces that lid cheek transition. You see less of the tear trough as that implant is placed to push those tissues up. Other ways to reduce the appearance of the tear trough include placing filler and also a lower blepharoplasty that can take the fat and reposition it over that trough. And yet another way is with a fat transfer to again blur that transition and reduce the trough. And in 2007, at the age of 44, when we compare back to 2003, you can see, especially on this right side, the lateral cheek is now protruding more. So there's an architectural change there that I don't think is explained with just fillers because of how regular that shape is, especially bilaterally. So I think that shape may have been due to the placement of a cheek implant. In 2008, at the age of 45, I see no change. And in 2009, I also see no change. In 2010, at the age of 47, Lisa did admit to an upper lip reduction. She was very public about this, and this is a surgery that I do in my practice, and this is something that I do for patients with a history of silicone lip injections, but also people who were just born with one part of the red portion of the lip being a little bit more full than the other, or they may have had prior traumas or other types of surgeries that may have left them with an area of prominence that doesn't look in sync with the rest of their lips. So for those patients, we do an upper lip or a lower lip reduction where we're basically removing the portion that's sticking out. And with silicone specifically, what patients think is that I'm going to go in there and I'm going to see every little speck of silicone. And that's just not the case. We're really not seeing the actual silicone. We're just seeing the areas of prominence, and we're going after those areas and removing just the right amount of tissue so that we can create more evenness and a smoother type of junction right at the wet-dry area of the lip so that it doesn't look like there's extra tissue. Also, some patients report that when they have that kind of tissue prominence, they might be biting on that tissue and that tissue gets irritated and then it actually grows even more. So it could affect even things as basic as eating. So sometimes a lip reduction is done for functional purposes and other times it's done for just aesthetic purposes, and sometimes it's both. So that's something to keep in mind with lip reduction surgery. And I use dissolvable sutures, so there's nothing that has to be removed. And it's overall a very reproducible, consistent, and a high satisfaction type of procedure. In 2011, at the age of 48, I wanted to point out here the philtral column definition that Lisa still has. And even though she's in her late 40s now, that definition persists because in many patients when they're younger it's quite defined, the Cupid's bow, the philtral columns, and as we age, we lose that definition. But in her case, it's still there. And the reason why it's really difficult to recreate with non-surgical or surgical types of methods is because the primary reason why you're seeing the definition is because the central portion of the philtrum is actually depressed, or it's indented, right? It's concave. That's what you're seeing as far as the definition, rather than the columns being so high up and protruding up. And so that's really where the difference is. When you do a surgical approach to try to recreate the columns, or you inject it with filler, you make those lateral columns stand up, but the center is still quite flat and in line with the tissue around it. The trick is to have that depression, and that's very difficult to create, right? So if you have it naturally, great. If you don't, then you're kind of stuck. In 2012, at the age of 49, I am seeing some signs of a potential brow lift with or without an upper blepharoplasty. There's now increased supratarsal show, and there's increased hollowing of the upper eyelids. And these are some of the unintended effects of brow lifting with or without blepharoplasty, because you're essentially creating more space in this region. And yes, you want to remove excess tissue, but it's actually quite easy to remove a bit too much and then have this type of hollowing, and also have an increased platform here. And usually it's not a big deal, and few people will realize it. And in Lisa's case, I think the area still looks extremely natural, and it was well done. The brows weren't lifted too much, and not too much skin was removed from the upper eyelid, but yet there is a change there, and I can appreciate that compared to prior images. In 2013, at the age of 50, Lisa's upper lip appears to have returned in its lateral fullness. So even though she had the lip reduction procedure 3 years prior, now what you're seeing is essentially a return of that tissue. And that is something that we see with lip reduction surgery, especially when it's done for a history of silicone injections. That silicone can continue to migrate around, and the tissue continues to form, like scar tissue and other nodules. And then you get this relapse tissue that, again, to resolve, you would need to go back in and do another lip reduction. In 2014, at the age of 51, I see no change. In 2015, at the age of 52, I do see some signs of jowling forming, and also there's now increased submental laxity. So that's the tissue of the neck as we start to see the effects of gravity and of general volume loss in the face. The tissues tend to sag, and that's where you start to see this kind of crepiness in the neck and additional platysmal banding forming as well. In 2016, at the age of 53, I see no change. In 2017, at the age of 54, what it looks like to me is that now the upper to lower lip ratio is closer to 1.5 to 1. Now the upper lip is really larger than the lower lip, and part of this has to do again with the history of silicone injections despite having had the lip reduction, and part of it is that our tissues continue to atrophy with time. So that bottom lip is starting to see a reduction in volume, and yet that upper lip is still having that fullness from those injections and the scar tissue that had formed. So now you have this discrepancy of that upper to lower lip ratio. In 2018, at the age of 55, I see no change, and that's the same through 2020. In 2021, at the age of 58, I do see some signs of a potential facelift. So there's now reduced jowling, the neck skin appears to be tighter, and when I compare back to say 2004, when you look at the sideburn area, there's less hair there than there was before. And that's another sort of giveaway for facelift procedures. So in addition to some of the tragal changes that we talk about, some patients will have a reduction in the sideburn hair. And that's because as the incisions are made to remove that excess skin during a facelift, some of that skin will carry with it some of those sideburn hairs. They're usually removed because it's hard to hide the scar in those finer hairs. So the scar is hidden in the temporal hairs. But as you do that, along with the skin that you're removing, usually those sideburn hairs go as well. Keep in mind that if those hairs are lost, you can recreate the appearance of a sideburn with a hair transplant, and that is something that I do in my practice for patients who've had facelifts in the past and they have maybe some scarring or maybe some lost hair. It could be here. It could also be in the back, depending on how the incision is created in the back. Some people lose hair down here, and that also is kind of a giveaway for a prior facelift. So some people will come in for a hair transplant where we can conceal those scars pretty well and restore the appearance of their hair. In 2022, at the age of 59, I see no change. In 2023, I also see no change. In 2024, at the age of 60, it looks like she may have had some fillers placed into different parts of her face, but also what I'm seeing is that there is some general fat reduction that's occurring. As that occurs, the implants, if we have facial implants, become more obvious because the fat starts to basically atrophy away around different parts of the face, and then the areas where we have implants, they stick out more. And Lisa was also public about her use of the Skin Vive treatment. This is a newer type of filler that involves a micro droplet injection of hyaluronic acid, similar to the micro droplet injections of silicone that she had in her 20s, but now this is a hyaluronic acid-based filler, so there is the potential of dissolving it, but it's basically marketed as a way to not increase volume of the face and just give it hydration that's long-lasting. But it is injected into the superficial layers of the skin, so it does have the potential to add some volume because hyaluronic acid is a sponge, so it's going to attract water and it's going to swell. So even though they say that it's not supposed to give you additional volume, what Lisa discovered and what many other people are discovering is that it does in fact increase that fullness of your face. If you want to hydrate your face but not have facial swelling or an increase in facial fullness, then you essentially need topical formulations of hyaluronic acid, so like a hyaluronic acid serum, for example. And there's a very good one at feelconfident.com if you want to check it out. By combining different molecular weights of hyaluronic acid, there are ways to still penetrate into some of the superficial layers of the skin and hydrate the surface without giving you that added volume. And the total cost of these potential procedures is $270,000. 10 years ago, Lisa was asked about her views on plastic surgery, and she said the following: "It's all about what makes you feel good. I don't care what you do. If it makes you feel good, do it. The judgment that we have on women is wrong, and if you want to do something that makes you feel better, go do it. And I'll just add this one thing: go do it as long as you're finding a safe and reputable surgeon." We have a growing list of trusted plastic surgeons on Feel Confident's Beauty Experts page, so make sure to go and check that out if you're looking for a procedure.